this is Wendy Steffes. I am going to be performing an integumentary assessment on my patient Ashlyn Verhoff. Basically skin, hair, nails, scalp. We're going to cover all those things. So start off with, I think it's important to begin with a family history, but then also just your history too. So have you had any recent changes to your skin or any concerns that you are aware of at this time? No changes? No. Okay. What about, are you taking any medications for your skin whatsoever? Or using any special ointments or lotions for your skin?
No, just mainly like normal face wash and lotion at night.
Okay. Do you have a problem controlling your body odor at all?
No.
Okay. And then what about like your hair condition? Do you feel like it's typically clean or more on the oily side, or?
I wash my hair every day. If I go without a day, then it gets very oily.
Very oily. Okay, so you tend to have more oily skin. And then what is your family history of like skin cancer? Do you have any skin cancer in your family, or?
Yes.
You do. Okay. So what? Who had skin cancer in your family?
I had an uncle who had skin cancer on his back.
What kind? Like carcinoma or melanoma?
I think it was melanoma.
It was
right?
melanoma.
Okay.
Yes. Okay.
And then didn't you have the scare too?
Well, your mother, yes, your mother did have a few suspicious lesions taken off of her body, but they came back benign, so that was good. Yeah. Okay. Are you prone to like sunburn or tan?
I've only sunburned a handful of times in my life, but I do tan. And
do you wear sunscreen regularly?
Yes.
Okay. And do you have any like tattoos or piercings at all?
No.
No. Okay. All right. So have you ever had like a full body scan check for, because you have a family history of skin cancer at all?
I don't think that I've ever gotten that done.
Okay. So that's always recommended if you do have a family history of it, is just a yearly scan, or if you've had any kind of past history of it, to do that as well. So, okay, so first I'm just going to inspect your skin, your general appearance of your skin. I'm going to note any kind of discoloration. You do have normal skin coloring. Her arms it looks like there's a lot of scarring on her upper arms, and that is because of picking your skin, correct?
Yes.
Yes, so you tend to have a nervous habit of picking your skin. So these aren't necessarily anything that I would be concerned with, but as a healthcare worker or a caregiver, I would definitely question her about that. Okay, let's talk about why we have some of these scars, and what is the reasoning for the picking. And so that would have to be addressed in a different situation. But since I'm inspecting the skin, I would look at that and we would address that at the time. So I would notice if there was any distinct odor. Ashlyn doesn't smell like she has any distinct odor. I don't really see any like abnormal skin variations, no breakdowns, no real abnormal moles, but I would do like a full inspection. And while I'm doing an inspection, I will just palpate as well, just to see if I feel any bumps whatsoever that I'm concerned about. And you don't have any like bruising? You do you bruise easily at all, Ashlyn?
I sometimes do bruise easily, but it's mainly just because I'm accident prone, so.
Oh, well that's nice to know. Okay. I'm just going to look at her skin here, and then since I am looking at her skin and inspecting it, I will palpate as well, and then I will also check her nail beds. They look very healthy. I don't see any signs of any abnormalities. And then I would check her caprifos as well, which are normal. So less than 3 seconds. Perfect. I don't see any abnormal edema either as I'm inspecting down her legs. And then I'll just take one sock off so that I can inspect your leg. She does have a few, like, it looks like we've got a birthmark here. We do have some, not necessarily lesions, but then they look maybe like ingrown hairs. So do you tend to have like problems with ingrown hairs at all?
Yes, I actually did just recently shave.
Okay, okay. Well, thank goodness, because your legs are nice and smooth. I don't see any abnormal scarring or anything, and like I said, no like pitting edema that I would be concerned with whatsoever. I would want to, I'll have you stand up. I would want to inspect her back too, and just look at if there's any kind of lesions here or anything I'm concerned about. It looks like she has a little bit of like back acne. I don't know if that's a problem. I'm going to lift up your shirt as well, Ashlyn. And do you tend to like pick your skin on your back at all, or?
Yes.
Okay. So we are definitely a picker, and we have quite a bit of scarring for that, but we know reasons for that. So I'm not seeing any problems skin-wise. It looks like she does have a little bit of acne on her neck. Okay, and then go ahead and sit back up here. And then I'm just going to inspect your scalp as well. So have you noticed any kind of scalp problems, or do you get dandruff at all, or?
I don't believe I get dandruff.
No, because you said that you tend to be more on the oily side.
Yes.
So I would just palpate around her scalp as well, just to see if I could feel any bumps or any kind of cause for concern. I'm not seeing any lesions. She has good grooming habits. She's very clean. I don't see any abnormal shapes or any kind of irregularities whatsoever. So it looks like you passed the test today, Ashley. Okay. Perfect. So health-wise, she has great skin except for her picking situation. And then also, I know she doesn't have this, but I know that you have a family history of keratosis pilaris, I think it's called, where we have some abnormalities with skin conditions in our upper arms, just from the formation of the extra protein keratin. So thank goodness you do. I thought that you did have that younger, but maybe you didn't. So.
I don't think I did.
No? Oh, okay. All right, perfect. Well, that wraps that up. Thank you so very much.